What's up, everyone? Dr. Darren Murphy coming to you from the Source Chiropractic Denver, and I am pumped and I'm excited because we're joined by...
My name is Meghan Fischer, and I found the Source Chiropractic 3 months ago. Why I came in was because I was having some physical pain in my back and just overall low-level anxiety levels, and I really was getting into body work and really coming to the understanding how important our physical bodies are that then relate to our emotional health, our spiritual health. So me being a shadow work facilitator, I really wanted to dive in with this work with Darren. And from the time that I started to now, I almost have zero anxiety levels in my body, no physical pain. I've lost 20 pounds, and I feel like I have a deeper connection to something bigger than myself that's able to carry on to my work and that I'm able to impact more people.
That's what I'm talking about. So the concept is huge. Coming in for physical pain, but over the course of chiropractic care, having newfound levels of personal awareness, mental awareness, emotional awareness, but also spiritual awareness. So what do you say we go ahead and get you adjusted today, Megan? So see here, I'm giving a slight tug on her feet. I'm seeing which side of her posterior chain, right side or left side, is not quite as easy as the other to pull. So one thing I notice here, look at this, her left heel approaches her butt much easier than her right. Do you guys see that difference? What that typically means is that her right sacrum and her right pelvis is having a more difficult time rotating, or the fancy word is nutating on each other. So let's go motion palpate this joint right up here. So right side, left side. When I motion palpate on the left side, it sinks nice and easily as I lean my body weight into it. Right side, I have to push and lean harder with my right side. So that's another indicator that there's dysfunction and that there is a posteriority of sacrum and pelvis backwards towards me. So we'll definitely address that for Megan as we go about. Something that we've worked a lot on with Megan is her breath, right? A lot of times people will come in and take really short, shallow chest breaths up here. So what we encourage people to do is take big, deep belly abdominal breaths over time. This is more fight or flight breath up here. This is more rest, digest, heal, and recuperate down here. So breath is a huge part of the healing process. Take a breath right down here for me, Megan. And then let it go all the way out. Opening move, creating space in an area before we make an adjustment. You don't just lay someone down, boom, 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 boom. No, it's like you got to let the body come to a place of peace and ease before being adjusted. All right, so Megan, we're going to take care of your sacrum on the right side. So you can face me on this side of the table. Now there's a very important concept in chiropractic, and that is the concept of adjusting from tension or adjusting from peace and ease. Now, it's very commonplace in our profession for doctors to adjust from a state of tension. Come here, notice this. This is a state of tension where I'm wrenching and torquing, right? So that it's easier to make an adjustment. It's more difficult to make an adjustment when it is from a place of peace and ease. So notice, her spine is relatively neutral, and what I'm going to do is I'm going to sink and engage into her sacrum and pelvis right down here, then I'll roll, and then I will drop. Instead of torquing her out here and then doing that. Let's not do that, right? So right here, her right sacrum is there. Nice breath here for me, Megan. Now notice, I gather, then I roll, then I drop. Right there. Okay, go face up for me. That cleared nice. Now let's have you go back face down. We're going to post check that so that we can see we made a change. Now what we want to see is, do her heels approach her butt the same way? Remember, before it was like this. Notice that. See, before it was like this. Now as I approach heels to butt, it's the exact same. I consider right sacrum nice and clear. Let's go up to her thoracic spine now. Another big deal for Megan is that she came in a slight state of flexion, meaning her shoulders were rolled forward you could see some anterior head carriage beginning to take place. And so what we've done, especially recently, is begun to do these extension style of adjustments, where we'll actually flip her over to adjust this part of her spine right here. So go ahead and flip over for me, Megan. And come seated for me. And Megan actually has a very flexible system. She has a big history in dance, motion, and flexibility. And so to tap into that flexibility of her spine, we need to use a few blocks. The more extension you place into a spine in an adjustment, the deeper fibers in the spinal cord and the deeper parts of the brain that are activated. Sounds like a good plan, huh? So, hand to shoulder, breath right here for me. Then we're going to come all the way back, let your head find the pillow. Yep, keep coming. Right there. Take a nice breath and notice the sink right back here. One more breath. I'm going to gather. Sink. Right there, help her up. Cool. Okay. Come on back for me. Let's do a total system check again. Notice internal hip rotation right here. Right rotates more than the left. What I want to see is the toes touch. Her toes are not touching in this moment. So we need to make a left hip adjustment over on this side. Let me see this leg here. Yeah. So what I want to do is I want to take it into full internal rotation and then do a distraction adjustment. She's going to feel her hip not separate, but she's going to feel it gap. It's not going to make a typical style of adjustment, but she'll feel it gap. Now we recheck. Look at that. Toes are touching. Internal rotation has been achieved on both sides. Come here, check this out. So now we're checking dorsiflexion of her feet. Do you see how her left foot dorsiflexes more than her right? Her right foot has a harder time going up like this. This is plantar flex, this is dorsiflex. Decreased dorsiflexion always has to deal with the talus right here. It's one of the many ankle bones. So we bring her foot up, and we're just going to traction and pull down here. Nice. Post check. Bringing both feet up now, and as you can see, both feet elevate the same amount. Cool. Function restored. Let's check her neck. So there's been somewhat of a pattern with Meghan recently that we've been working on and we're getting close to clearing. And that is an anterior pattern here in the front part of her neck. SCM, sternocleidomastoid, anterior and medial scalenes, they feel tight, they feel tense, right? And the muscle belly is shortened. And so to erase and to cancel out that anterior flexion, we're going to adjust the front part of her neck here. You can do it typically one of two ways, either a push or a pull. We're going to do it by a pull today. Megan, can you have your feet come up for me so your knees bend? So the adjustment is going to take place right here. Now it might look like I'm making the adjustment from the left side, but I'm actually pulling from the right. See my finger right down here? That's right on the attachment points of her SCM, anterior, and medial scalene. Right there. Very good. So now, let's recheck. Make sure that we've actually made a change. I don't feel near that tension and that tautness in the front part of her neck on the right side. I consider that clear. Now, C2, bilateral adjustment. Occiput here, atlas here, C2 right here. Now notice this. It's very common in our profession to laterally flex and then rotate full, and then make an adjustment. Her system is not at peace there. It's not comfortable, right? So let's bring her spine to more neutrality. She's at peace here. I can see her blood vessels, they're pumping fine. There's no tension or stress in her neck. Her eyes aren't fluttering. All of these are indicators and signs that her body is at a state of peace and ease in the adjustment. A great question to ask yourself, and any chiropractor you choose, is your chiropractor adjusting from tension, or is your chiropractor adjusting from a state of peace and ease? That's a big, big indicator of how much better you're going to get. Let that left arm fall for me, Megan. Left leg falls. Right there. All right, good to go, Megan. I got you here. Come on up. All right, thank you so much.
Thank you
for the opportunity. If you're looking to be served at a high level, to be seen and acknowledged at a deep level, the deepest levels of your being, know that there are chiropractors in this city, in Denver, that can do that for you. My name is Dr. Darren Murphy.
I'm Meghan Fischer.
And we love you, we appreciate you, and we look forward to being your chiropractic team here at the Source Chiropractic Denver.